Hello! In this video I'm going to talk to you about sciatica, pain from sciatica, and injection into spinal low back area of steroid based medication, and share my experience. Okay, for little going ahead in this video, I'm going to quickly talk through the whole thing, and then I will go into more detail about my story. So please like, comment if you ever had the sciatica pain, and what did you do, what worked for you, what didn't, and subscribe to my channel to support my future creation of content. With that being said, let's go. Well, we do have a long nerve that goes through our spine, and then it's bifurcates or divides into different branches at the different areas. Some of those branches start at the low back and they go into your legs, and they called sciatic nerves. If for any reason bulging disc, herniated disc, injury, for any reason those nerves get aggravated, irritated, inflamed, then you're gonna have pain. Oh, sciatica pain is terrible, terrifying, and it's heart-wrenching pain. This pain goes from the low back into the buttocks. Sometimes it shoot down through the legs, sometimes go past the knee all the way to the foot. This pain is bad. It's the toothache, tooth pain, it's really similar, but it also has some burning sensation to it, and it's travel, and it can cause like numbness sensation. With all this being said, I'm not a doctor. This is my personal experience. Don't take it as a medical advice, okay? Back to the sciatica pain. It can happen out of the blue. You might sneeze, you might cough, you might twist awkwardly, and boom, there's a pain that won't let you be. You're gonna go on the YouTubes, you're gonna go on the internet, you're gonna read all these articles, you're gonna start taking medications or not, start doing stretches or not, and hopefully, I really hope that whatever you're doing will help you with that pain, but chances are it won't. Some medication can give some kind of level of relief, but as soon as the medications wear off, the pain comes back. So some stretches helps out, but you can't always do stretches. Let's say if you sitting in a car, pain is there, how are you gonna stretch? And you let's say driving, commuting for 30 minutes, yeah, you won't be able to tolerate. If it's real sciatica pain, you won't be able to tolerate it. So it will affect the quality of life in many cases, and it might lead to a permanent nerve damage to a leg, which will affect the strength of the leg, the sensation in the leg, and with that being said, it can be treated with different anti-inflammatory medication, with different stretches and exercises, and if they'll do MRI and they see what causing sciatica, for example herniated disc, they might do a surgery to get rid of that herniated area of the disc. One of the most effective, or I don't know, maybe it's not most effective, but from what I heard, it's pretty effective way to help with sciatica pain is the injection of the steroid-based medication that take away inflammation and the pain, in many cases instantly, in other cases over a day or two goes away. Some people say, not always, some people say it doesn't help them, but mostly I heard good feedback. Now my story. If that's all you wanted to know, that's it. Thank you for watching. And if you want to know about my story, here you go. So I had a bulging disc in my low back for years, you know, giving me pain here and there. And one day I was in the bed, I sneezed, and I felt weird. That the pain started going from my back into my butt, and then it was in my leg, like my back of my thigh. It wouldn't go away. I start driving, and the pain is there. I keep moving my leg, and the pain doesn't go away. I pull over, I get off the car, try to stretch it. It still wouldn't leave me alone. It wouldn't go away. So after dealing with that pain for a day, I couldn't tolerate it anymore, because I couldn't sit, I couldn't sleep, I couldn't lay down and relax. It was just there. And I went to emergency room. They gave me some medications and some referrals to other doctors, and that's how my journey dealing with my sciatica starts. Well, what did I try other than anti-inflammatory medication and pain relief medication? I did try physical therapy. I did try chiropractor, and as well as like acupuncture, capping, massages, stretching. You know, I would get some relief here and there. It was manageable, but it would never go away completely. And the worst part, it could always start coming back. And it was scary. You know, every time I would be feeling it coming back, it would terrify me, because when it was in my worst, when this was at my worst, it was months of taking medications and not able to leave the house because I couldn't sit in a car. So yeah, it's kind of traumatized me. And I do like outdoors. If you watch my other videos, I like to go in the woods, I hunt mushrooms, I like to hike, and yeah, every activities I like to do, I had to, you know, get in a car and get there, and I couldn't, because I couldn't sit on my butt. So anyhow, somehow I was able to manage it with all this stuff. I got MRI done. They look at the images, they say, well, there is some herniated disc, there's some inflammation, so maybe you need a surgery. And surgeon look at it like, surgeon like, well, no, you don't really need a surgery at this level, but here's your referral for a pain management clinic. I went to pain management clinic. They look at my images, went through my history, and I'm like, you know what? Let's do it. So they should suggest to get me an injection in that area of pain. But this injection is not superficial, it's deep, okay? It doesn't go into your muscle, it doesn't go into your veins, it's go right there next to the nerve. So it's done in the clinic, in OR, pretty much in operation room. So I go over there. They tell me, you know, the preparation, like don't eat this, don't drink that, don't take these medications prior for that many days. If you ever go through this, make sure you follow instructions from the doctor. My doctor was great, and I went in. They told me bring the driver because I will need a driver to get back after the procedure. So I brought my driver for my appointment. They got the phone number, everything. First thing, it's a pre-op. You go in, so you make sure you check your birthday, get your contact information, make sure you know why you're here, and then you go into the lockers. They give you some gown, tell you to put it, you know, open it on the back of the necklaces, jewelry, all this stuff. Pretty much all the clothes except your bottom underwear goes in the bag, put it in the locker, they lock it, you go in the chair in a gown, and they check your vitals, your blood pressure, your pulse. The doctor comes over, talk to you about the procedure, talk to me about the procedure, ask if I have any questions, I ask my questions, and then another nurse comes in, takes me to the procedure room, go over there, I lay face down. The first things they do is making sure I'm the right person. I hear them talking about me, doing, I think, what is called timeout, when they recite everything what they're about to do and why and to who. And as soon as they finish with that, the first thing he did, use some piece of metal to do some markings on my back. That was cold. That was pretty cold. Then next thing, he used some medication to swap it, to clean the area, sterilize it. I think it was Benadine, I don't know. It was also cold. First poke I felt was a injection. It's I think it was lidocaine, I don't know, but this is numbing, like local anesthesia for so you don't feel the pain from this procedure, but that numbing injection itself, it's kind of painful and burning, but that's probably the worst out of everything. It's not so bad, but that's the worst one out of everything else. So they numb the area. He said after that, if you don't feel the pain, only pressure. If you feel the pain, let us know right away. Okay? So I said, okay, now I'm going to insert a needle. I guess he did insert the needle. I didn't feel anything. He said, now I'm gonna inject contrast to make sure everything in the right side, in the right place. Bring the x-ray machine, took the picture. You look at the picture and make sure everything in the right area, that they're going for my left sciatic nerve area. And okay, next one is going to be a medication. So you're gonna feel some pressure. Again, didn't feel no pain, but I did feel something. I felt something going in the area where my sciatica pain used to be. It's like, okay, we all done. I'm gonna pull the needle out, clean you up, put the band-aid, and give me instructions what not to do. I was like, can I go to work tomorrow? I was like, yeah, just be easy. Don't do too much. Don't lift anything heavy, but If you want a day off, just let me know. I'll give you a note. If your work require you any strenuous activities, but if you think you can manage it, it's okay. Don't be submerged in the water or soaking in the water for like 7 days, but showering is okay. And I'm like, let's see if you can walk. So I got up. Yeah, I could walk. I feel a little bit slow in my lower half of the body. Like I was like, yeah, making a step, but my leg's still making it. I already think I made it, but my leg's still moving. But yeah, I made it out from the hospital. My driver got me there. Got me some delicious mochi donuts. Thank you. And we went home. So that day I didn't do much. Still feel a little bit slow in my low back area, like below the waist area, pretty much. But the sciatica pain was not there. That was a weird feeling because I had it for years. You know, it would be worse or it would be like manageable, but it was always there. And that was the first time in years it wasn't there. Yeah. The next day I was at work. My legs were still a little bit behind from how, you know, as fast as I wanted to go, but the legs would not keep up with with my intentions. But everything worked. The legs worked fine, just slower than I wanted to. And there was no sciatica pain, but there was some soreness in the low back area of the injection. And that lasted for one more day. So today is day 3. I don't have sciatica pain. Thank you, doctors, nurses. Thank you for watching. This was my story. And soreness in lower back is gone. Sciatica pain is gone. Legs moving the way I intended to move. Life overall has better feeling to it. All right. See you next time. Let me know what you think about this video and share your experience with sciatica. Bye.